Hi, I'm Dr. Robert Dean, and I'm here to talk about AROmotion. AROmotion is a new procedure that fills the void between Advil, Motrin, anti-inflammatory medicines, and total joint replacement. Finally, there's something that isn't as extreme as joint replacement, but not as passive as an anti-inflammatory. AROmotion combines three different techniques. One is called radiofrequency ablation. This is an FDA-approved procedure that's been around since the 70s. It's not new, and it's available. The second is the use of an ortho biologic, something to help stimulate and nurture the microenvironment inside of the joint so that we can get healing and hopefully regeneration. The third is strengthening and rehabilitating the muscles and ligaments that move that joint so that this whole joint as an organ, as an entity, can actually function the way it was meant to function when it was healthy. So AROmotion works by addressing the cause of your problem. If you're in the office seeing a physician, you're there because typically your knee hurts, your hip hurts, your shoulder hurts. And when you're told you need to have it replaced, that very simply means that you have nerve endings inside of the joint that are exposed, that aren't protected by that hard Teflon-like hyaline cartilage, and that pain is interfering with your life. What we focus on at AROmotion is the pain and solving your problem. So if your joint is mechanically still intact, you're walking without a walker, you're not in a wheelchair, the hinge is flexing, the ball joint is moving, you just have narrowing or wearing of that arthritic cartilage, then what would be the best thing you'd want to hear? We can stop the pain. If we stop the pain, that doesn't just make your knee feel better. Your knee feels better because A, the pain fibers are now not telling you there's pain, but B, those pain fibers have also been secreting little nerve-induced factors that stimulate and perpetuate the inflammation or the arthritis inside of your joint. So your pain isn't just something you're feeling and you're thinking in your head. Your pain is actually the source of this chronic pathology that's destroying your joint. So by turning off the pain, we're actually neutralizing the negative environment inside of your joint capsule so that that tissue can learn or can start to heal. We want healing, but we need to neutralize the negative toxic microenvironment. So radiofrequency ablation is a technique of turning off those sensory nerves, and by turning off these sensory nerves, guess what? Your joint doesn't hurt. It's within days, 2 to 3 weeks maximum. It's a very quick process. And more important than the nerve pain being turned off, the inflammation and the swelling and all the toxic factors that are in your joint that are causing this slow chronic destruction of that cartilage, that hard Teflon cartilage, that process has been mitigated, stopped. So now you have healthy synovial fluid so that other things can happen. Positive factors your body can secrete, less toxic inflammatory proteins, and guess what? Your knee doesn't hurt. So when your knee doesn't hurt, you're going to start swinging your joint normally. You're going to stop shuffling your feet, you're going to stop doing a lot of the limping and the subtle compensations you've done to take the pressure off those specific potholes. These are some of the benefits of the radiofrequency ablation, and it's a huge and very important tool that's currently available medically. It's FDA approved and a beautiful technology. Once we've stopped the pain with the RFA and the microenvironment of your joint capsular fluid has normalized, the inflammation, the toxic proteins, interleukins, cytokines have basically been mitigated. Now the ortho biologic that we place into your joint can actually help lubricate, cushion, provide some of these factors and different healing properties to tip the scale, right? So you've been living with a joint that's been chronically inflamed and deteriorating. We've neutralized the deterioration, and now we're tipping the scale towards more of a healing microenvironment. The orthobiologic is a key part of that because that's what's going to actually help enhance that microenvironment so that the chondrocytes, which are the cartilage cells, and other parts of this joint will promote healing and your own body's healing properties so that these potholes or these worn out areas called chondromalacia can heal over time and protect those nerve endings that were exposed. So now that we've turned off the pain, we've normalized that microenvironment, we've enhanced or tipped the scales towards healing, the muscles and ligaments around the joint, they need to be tended to. This is where rehabilitation, strengthening, reconditioning of the muscles and ligaments that move that hinge or that ball joint come into play. This is the third component of AROmotion, and it's extremely important because Your muscles have adapted. They've adapted to your altered gait. They've adapted to you compensating for that pain that you've had for years. Now that the pain is gone and you're on the road to healing, the second part of healing is not just addressing the ball joint, it's addressing the function of the rest of the muscles and ligaments in that joint. And this is a process that is done through a prescription, individualized program that our physical medicine rehabilitation board-certified physicians will prescribe for you and follow you with. If you'd like to learn more about AROmotion and whether you're a candidate for our treatment, please schedule a consult, come in and see one of our board-certified physicians, and let's evaluate your joint.